You spent years in the load, maybe rucks, armor, long miles, doing what needed to be done. Now, a simple run lights up your back, knees, or your Achilles. If you're a high performing veteran, maybe you served in combat arms or special ops, but you still run, but you're not running at the same level you used to, right? You got maybe some nagging injury that's slowing you down, or maybe you're into lifting, but you can't lift as heavy as you used to. Or maybe you like to compete in martial arts. Maybe you train jujitsu, you train Muay Thai kickboxing, but you can't train at that high level as you like. You have to, scale it back because of nagging injuries. Well, I'm Dr. Ray Peralta, physical therapist, Marine veteran, and run coach. And over the past 10 years or so, I helped everyday athletes, weekend warriors, and veterans get out of pain and back to hitting PRs, whether it's in running, lifting, or just getting back into competing at a high level, like doing jiu-jitsu tournaments. So I'm going to show you why I had to solve nagging injuries for athletes who want to keep operating at a high level. And I'm going to share my story and some of the breakthroughs I found and, why I'm on a mission to do what I'm doing today. So, nearly 40% of veterans deal with some type of persistent pain or chronic pain or nagging injury, right? Some of them vary from severe, some are moderate, but still, it doesn't have to be this way. You don't have to consider this part of the new normal that you have to live with back pain or knee pain. And, what I noticed is that there's a lot of limitations, but we're going to go into it. But I want to also share my backstory because I've dealt with injuries myself. So I enlisted at 17 years old into the U.S. Marine Corps. And when I got into the Marines, even before that, in my head, I thought, hey, my dream job, I'm going to be a recon Marine. I'm going to go join Marine Corps, go into recon Marines. But I went in there, I pushed everything. I wanted to be, I wasn't happy with just hitting the minimum. I know a lot of my fellow recruits when I was going into the Marine boot camp, they just wanted to get by, hit the minimum. But no, I wanted to ace it. I wanted to push, do the best I could do in the run, pull-ups, push-ups, right? I even actually practiced swimming after school, because swimming wasn't a strong suit, right? So, went through boot camp, got into infantry training school, and then there was a moment where, there was like tryouts to get into for selection to the Force Recon, no, excuse me, just Recon Training Battalion, or the selection process. And there was a swim component, but then my back seized up and it just shot my confidence, right? Because this injury, I'm like, oh, I don't know if I could perform. Sure, I could swim, but, I wanted to perform at a high level and it just really sapped my confidence. So I ended up not trying out for the Recon Marines, and it just really still kind of ate at me, just feeling like a quitter, right? And then it got even worse. So the back pain. So then I got into my unit, and I was in Camp Lejeune. My MOS was 0311 infantry. So working up on a 12-mile ruck. I still got another flare up of this low back pain, and I started having leg pain, sciatica down the leg. It went from annoying to career altering. It started making me really depressed and worried that I couldn't perform at a high level. Right. It was already bad enough that I, couldn't go through the recon thing. And then now it's like, oh man, I don't know if I could ship off to, go with my boys out to it was Operation Iraqi Freedom. So, I ended up getting depressed, having all these mental health issues, and I ended up getting medically discharged from the Marine Corps. My identity was rocked. Went from full send, right, to can I even sit through a class, right? Can I even sit through a college class? I left the Marine Corps, went into community college, and I was just dealing with back pain. The military docs told me, hey, just take some pain meds. They did some scans, right? They saw, did an X-ray, but it looked pretty benign. Yes, I had scoliosis, but they couldn't explain why I had this severe pain, and it was just so frustrating because I was like, man, what else can I do for this? I did what the docs told me: rest, ice, meds. Got different opinions, but the system kept chasing symptoms, right? Pills, different types of pain pills, back braces. They even considered that I should do maybe some epidural steroid injection. I opted out of the injection because I was like, man, I heard mixed reviews. I didn't want to try it. And then they even thought, hey, if nothing works, maybe consider surgery. But I'm like, no, there has to be another way. And I would take it easy, and sure, the pain would temporarily get better, right? The resting did work. I'm not saying it didn't work at all, except anytime I try to push to a high level, the pain would come back. And anytime I go heavy deadlifting or try to go on a long ruck or run, the pain would come back. And I definitely didn't want surgery. I was young. I was like in my 20s, right? I wanted my body back. I wanted to perform at a high level, and a plan that actually worked. So the breakthrough, right? I actually discovered a special type of physical therapy called the McKenzie method. It's an assessment-driven, exercise-based approach that kind of teaches patients on how to self-manage their symptoms, right? Through simple, precise movements or exercises, I started to, get some pain relief, right? And so I thought, okay, if a movement or certain positions really showed me the value of certain positions, because a lot of people don't know this, but a lot of positions that you do in your everyday life can cause or be a precursor for persistent pain to continue to occur. For example, with back pain, a lot of times people don't realize it's just their sitting posture is contributing to their back pain. So like, oh, they're blaming, sport or an activity when it's really that they just sit like 8 hours a day and not, move around and stretch, right? So going through this McKenzie method approach, it showed me that targeted mechanics, targeted movements can actually help a lot of these cases, repeated movements. And it's a great system. Like if you've been dealing with back pain or knee pain, definitely work with someone who's trained in the McKenzie method. And that's actually, it inspired me so much. I actually became a diplomat in the McKenzie method. So now I have a diplomat in the McKenzie method. I help myself, I help others with their chronic pain and injuries. I'm a physical therapist who's trained in this McKenzie method. So it's one of my favorite methods of physical therapy. But that being said, even though I did get relief from it, there was still a gap, right? There was still a gap from, rehab, the injury rehab side of things to performance, right? So that's where I was like, okay, I wasn't still performing at the high level that I wanted to. So I formalized a framework that works for high performers, veterans, athletes, weekend warriors who still, obviously they want to get rid of their nagging injury, but they also want to perform as well and also prevent future injuries from reoccurring with, high level sport, right? Especially if you're performing at a high level. Sure, if you're like taking it easy, you're just going to be a jogger, a hobby jogger. This, you're probably okay. You're okay with just the rehab pain relief. But if you want to perform at a high level and not having to slow yourself down, hold yourself back, and then you take some notes out, get a pen out, take some notes. So obviously we want to reduce the pain. So if you're dealing with a nagging injury, right, there's usually some movement related thing that's contributing to it. But in other cases, there is about a quarter of people, 25% of people also have this chronic pain syndrome where the pain is more due to a hypersensitive nervous system. Sure, the McKenzie method touches on it a little bit, but there's some other lifestyle habits or lifestyle medicine approaches that can address the people who are in this 25% category whose pain is also due to the hypersensitivity of the nervous system, right? So what this includes is also doing aerobic exercise. And you're like thinking, but hey, if I have a nagging injury, I could do aerobic exercise. You're going to have to modify it. So for a lot of people who can't run because of the pain, or maybe they can run, but have to really slow themselves down, they may have to cross train. So you could cross train on a bike, you could swim, you could row, right? But then you also have to do other things to calm down the nervous system, right? Some breath work, meditation, journaling. There's a whole bunch of things you can do to help reset or calm down the nervous system. But then you also have to do graded strength training, right? So you also have to restoring the strength around the joints, ligaments, the muscles, right? So think about the posterior chain, the anterior chain, the lateral chain, right? Single leg strengthening, right? Trunk endurance. You have to train all these different facets because the body is integrated as a series of systems. And then you also want to rebuild, right? So you have good form. So your biomechanics are good. So whether you're training to be a runner or training to go into lifting or even into martial arts, you want to have good biomechanics, good form, which are how your body goes through movement patterns. And there's some functional movement patterns that people should be able to move well without compensations or imbalances, because when we move when imbalances, that can also cause future injuries to pop up or cause a pre-existing nagging injury to continue to persist, right? So now to rebuild your biomechanics the right way. And then nutrition, recovery, and fueling, right? Sleep and nutrition. A lot of times people overlook this factor. And unfortunately, I see this a lot in the physical therapy world where people are like, oh, I know I got to sleep. I know I got to eat, but they don't actually dial it in. So maybe they still eat junk food, or maybe they're still sleep deprived, getting like less than 6 hours a night. And they wonder why their injuries are not fully healing. See, tissues remodel and repair when you're resting and also properly fueled, right? So if you're under eating, you're not hydrating properly, right? You're not getting your protein targets, you're not getting your sleep, that's going to make it a lot harder to recover from an injury, no matter, even if you're already doing the exercise, right? So you need all the pieces of the puzzle. You can think of like parts of an engine, right? If you only have one part of the engine is going to be incomplete, right? You need all the different parts of the engine for it to be, fully functional, fully operating, especially a high speed engine. If you want to go at high speed, if all you care about is just walking your dog, then sure, you could get away with having an incomplete, recovery process. But if you want to take it to a high level, you need all these pieces in play, especially also want to prevent future injuries from happening in the future, of course. So for me, when I started implementing these changes, right, proper movement, right, doing the McKenzie method exercise plus the aerobic training, the strength conditioning, working my biomechanics, my form, and then the recovery, sleep, right, nutrition and fueling, I was able to eventually get back to running pain free. I ran a sub 3:30 New York City marathon back in 2019, and also training in jujitsu and lifting, doing all these different sports at a high level where feeling confident, strong, and now I have to worry about, okay, if an injury happens, I'm not going to have to take months and months off of training because I know how to bounce back. I'm currently actually recovering at the time of this filming, just had a hernia surgery like a month ago. And I had the tool set to, rebuild and get back into training without having to like freak out or go like, oh, I have to go to multiple different doctors, go to different physical therapists to help me out because I already got the skill set to help rebuild, rehab myself, retrain my core, and get back to getting back my speed and my strength. So I've also helped other people as well. So people are like, okay, good for you, Ray. What else have you done? So I also, for almost past 10 years, have helped all sorts of folks. I've helped former military, everyday weekend warriors. There's a guy who I think of a former Marine. Uh, this guy had a persistent knee pain that was slowing down, and he was also a bit overweight. But we worked together online virtually to help him get rid of the knee, identify the exercise he had to do. And on the surface, you'd be like, whoa, those are simple exercises. What, some knee straightening exercise, some squats, some step downs? I could look that up. But the thing is, it's not just the exercise alone, but it's my assessment because I had to assess him to see what is the right exercise for him because the exercise you do does matter. You just can't take a shotgun approach and throw a bunch of random exercises at the problem. You have to be like a sniper, a precision exercise. You have to know which exercise you're actually doing, whether it's for mobility, whether it's for strength, right? See, a lot of times people think, oh, I know about exercise, just Google or ask ChatGPT. The thing is, oftentimes it takes a shotgun approach. But again, when I refine it, right, like laser, surgical precision, we get rid of the pain a lot faster, right? What this guy who I was working with in just like 2 months, he was pain free, and then he was back to running. He was running 5Ks, and then in 3 months, he even lost like about 15 pounds or so. So he lost 15 pounds, got rid of that knee pain that he had for years after the Marine Corps, and then he was able to go back to running 5Ks. Right. So I've seen this pattern repeat with all sorts of clients, right? You get the mechanics right, you get the overall lifestyle habits right, the recovery plan right, and the performance returns, and you can perform at a high level. So the enemy isn't you, right? It's these generic cookie cutter plans, right? The traditional healthcare system that just kind of focuses on the one body part, right? Sure, you could go to a generic physical therapist and don't get me wrong, there's some good ones out there, but at the same time, they're oftentimes limited. They're just giving you the exercise, whatever, for the body part. And then, okay, you're treating the body part, but then what happens? You leave the clinic 3 months later, 6 months later, you go back to like performing at a high level and the pain returns or some other injury pops up, right? Because oftentimes don't teach you a holistic approach on how to keep yourself resilient, how to bounce back. So you oftentimes don't have like a tool set on how to prevent future injuries from reoccurring, right? Or you try to follow YouTube, right? You get these one size fits all advice. And then you're trying to chase symptoms like, oh, I have this knee thing here, I got the shoulder thing here, this neck thing here. You keep chasing different symptoms, trying random cookie cutter plans, and you're just kind of like a dog chasing its own tail, going in circles and circles, and keep being frustrated why you continue to have these nagging injuries. They might get a little better, but they never fully go away, right? You keep having these incomplete recoveries. So if you're sick of having these nagging injuries, incomplete recoveries, I'm actually launching a 28-day Operation Pain Free to help high-performing veterans and athletes, everyday athletes who are dealing with nagging injuries, who want to run, lift, maybe even do martial arts, or just be able to train at a high level again, right? So join my 28-day Operation Pain Free Challenge. I'm hosting inside my free Skool community, so you can check it out. I'll put the link in the description. You'll get a weekly plan, some checkpoints, and if you're really going to, you can work with me one-to-one for coaching support to help you calm the pain fast, get this rapid relief, and start rebuilding strength and performance because you want to perform back at a high level, right? And you also you don't want to settle for just incomplete recovery or just just be able to go outside for a walk. You want to be able to go run. You want to be able to go lift at a high level without these nagging injuries holding you back. So if you're really motivated to get started, hit the link below, request access. You can send me a DM once you get into my free Skool community. You could hit like, hey, Ray, OPF. So I know that you're interested in this Operation Pain Free, and we could get started and see if there's still spots available to work with me one-on-one. Anyways, I'm out, and be well.